you ever wondered why some people look and feel half their age? It's no secret. Millions of people are now using laser therapy to treat everything from chronic pain, fat loss, nail fungus, and more. By applying specific laser colors, you can achieve different drug-like effects, all without harmful side effects presented by prescription medications. For example, NSAIDs such as ibuprofen work through biochemistry to effectively suppress your immune system to reduce inflammation, resulting in pain loss. However, as this drug passes through your system, it leaves side effects in its wake. Lasers can be used to target and stimulate the mitochondria of a cell to increase the energy production within the cell, so it can perform essential functions needed to stabilize. The increase in mitochondria energy provided by the Zirconia laser will produce signaling molecules shown to activate various beneficial biological changes. And with Zirconia's various products utilizing different wavelengths, you can take total control over these biological changes, such as fat loss with our green laser products proven to shrink fat cells, stimulating the body to create antifungal and antibacterial agents with our red-violet laser products, and increasing blood flow and nutrients with our handheld or scanner red laser products, proven to decrease pain, reduce inflammation, and accelerate recovery times.
Good evening to everybody. My name is Charles Gaines. I'm your host tonight. I'll be producing tonight's webinar. This is Peripheral Neuropathy Secrets Revealed with Dr. David Bradley. I want to thank everyone who's joined us tonight. This is our first of what we hope to be many of these webinars, and we're so glad you've joined us tonight. I'm about to bring Dr. Bradley on the stage here in just a moment. You should be in an area where if you'd like to comment, we would love to get information from you. If you have any questions, you can just type it over in the comments. I do see some people already showing up now. Elaine, I did see that you are on board. Hopefully, Don, you were able to get in. So if you have any questions at all, feel free to just put them in the chat, and we'll try to bring them up to the doctor in good time. We're going to spend some time together answering your questions. Dr. Bradley's got a full presentation for you tonight. So without further ado, I'm going to bring Dr. Bradley in. Dr. Bradley, how are you doing tonight?
Doing quite well. Thank you. I'm kind of excited about doing this. This is bringing me into the 22nd century. And I'm not kicking and screaming. I'm going like, how do we get there from here? So I'm excited to be able to bring the information because what my heart and my desire is to help as many people as possible to get as well and as healthy as possible. And tonight's topic with peripheral neuropathy is one of the conditions in America that is in the top 3 conditions that has been spiking and growing exponentially. And there's no other treatments available that are effectively reversing and resolving this. Some of it's being masked, but we're going to get into that tonight.
Absolutely. Well, I want everybody to feel comfortable. Just as if we're in your living room, thank you for bringing us here, and hope you enjoy this. I know, Doctor, you're going to talk a little bit about what was originally planned was a dinner presentation. And so I know a lot of people I've talked to are excited that they can meet with you one-on-one in the comfort of their home. So with that, Doctor, I'm going to pitch it to you when you're ready. I'll start the slides, and if you get some questions, I may jump in and put one on the screen. All right?
Good. Let's go ahead and start with the slides and get going with this because I know people have other things to do. So again, we want to start out with this is we want to talk about getting long-lasting relief from pain, numbness, burning, tingling, cramping, all without surgery. So, you know, all too often what we find is that surgical interventions is what everybody goes to. So we want to be able to get around that. So normally when I do this is I have people I can see your hand. So if you have the ability to raise your hand or make a comment in the comment section, please do that because it helps me to know if I'm connecting with you, if I'm saying the right things or getting the message across. So of this, who would like to have at least 60% improvement in the way that you feel? Anybody? 100% improvement. So got anybody that's technologically advanced can click in there. So normally when I see this, we'll have a few people that'll raise their hands. The other ones are kind of tentative of like, can I really have an improvement in my life? Is it really available? Are you just trying to feed me a line of stuff? So with this, we're going to say, yeah, it is going to be available. But we have to make decisions. And the first decision that you made to move towards this ability to improve yourself is to be here listening to this presentation. Take notes, please. And then I don't mind being grilled on any of this information. It's all well supported by research. But you've made the decision to be here today. And in saying that, you have an open mind. You've kept an open mind. And all too often, I've talked with healthcare professionals. I bring them the research, and they won't even look at the research because they're so close-minded. Now, it seems crazy to say that, but if we start nipping around at these areas, then we start nipping around at, am I actually doing the right things for people as a doctor? And so my heart has always been to keep looking and searching. For those of you that know me well, I'm always coming up with something new to bring to you. And it's going like, what's he got this week? Because I'm always researching. My mind is always open. And I always want to take a look at how I can help you get relief. And can you really get relief? So along that line, I want to know is if you're experiencing any numbness, tingling, pain, or stinging. Numbness is one of the first symptoms that we see, a lack of sensitivity for peripheral neuropathy. And it's hard to understand that. Second one, a lot of people experience a burning sensation. So anybody experiencing the burning sensation? Bueller, anybody reference that? So if you're feeling a burning sensation, that's another form of a neuropathy. Pain into the hands. So we often take a look at carpal tunnel syndrome. Carpal tunnel syndrome has a surgical success rate of only 4%, which is kind of amazing because it's being done a lot. I was in a mixture with medical doctors and with chiropractors, and I said, oh, I just saw this research that said that over at R.H. Dedman Hospital over in Dallas, they have a 15% success rate with carpal tunnel surgery. And this medical doctor, a neurosurgeon, says, oh, no. I said, what do you mean, oh, no? He says, oh, no, it's only 4%. I said, you are kidding me. He says, oh, yeah. 4% is what we can expect to get for the carpal tunnel surgery. So that means only 4% is a problem with the bones of the hand. The other hand pain is coming from a neuropathy, the pain from the nerve. Back pain is not commonly thought of as a neuropathy, but your nerves are not happy. Something is saying I got trouble, and it's giving you the signal of pain. Joint pains, any joint pain in the body is actually a warning signal of a problem. It may be the joint itself is in trouble, or it may be that the nerves that go to the joint aren't working right, and that wears the joint out. So there's multiple reasons for this, multiple ways that these occur. And from this, we have to know, where do we look for this? Where do we look for the causes, not just getting rid of the symptoms? So after tonight, what I want you to understand is this. I want you to have some things. I'm challenging what you've understood as the truth for standard treatments. I'm going to challenge that what you've been trained to believe in with new information. And you can challenge me at any point. Where's the research on this? I'll get you the research. But we want to say what can be causing your pain, not just the pain. The pain in your head is not a lack of ibuprofen. The pain in your leg is not a lack of Advil or Aleve. The pain that you have is not the lack of a drug in your body. The drug is merely covering that up. We also want to take a look at the documented signs and symptoms and the dangers of neuropathy that you may not be aware of how really significant and severe these conditions can lead to life-altering problems. And then we also want to take a look at giving you some simplified steps that you can take. Now, the steps may not be easy, but they're simple. What we have from research tells us how the body works and how it's going to work, and then how you need to make that work for you. And you get to make these choices and ask all the questions. Like I say, we need to ask, if we're having these symptoms, are you tired of taking the medications? On average, there's 18 new prescriptions per year coming out. New prescriptions all the time. And if you take a look at, let's say just a simple one, you take a look on the television, they've got drugs for depression. Well, if you're not fully not depressed, now they got another drug they'll put that other one on there. So you're taking 1, 2, 3 drugs for one condition, because it's not getting rid of it, or it's coming back because the drug is wearing off and not effective for you. So we want to take a look at, if you're tired of taking drugs and medications, tired of taking a look at taking more drugs and medications every year, you're in the right place. I do want to take a look at some disturbing trends. Now, I won't even mention what happened with the COVID vaccines, and now they have like 16 COVID vaccines coming out. So I always look at it, if something is effective, one ought to get it done. But let's take a look at what really crashed America recently. So we have an opioid crisis. Anybody heard of that? The opioid crisis was brought on by Big Pharma. And it was an opioid. There's a great movie on Netflix, I believe, called Painkiller. And it really is an eye-opening show of what medicine has become as a rule, as a way to make money, not a way to help people. And even knowing that their drugs were harming people, they continued to sell them, knowing that they were going to take away more money than they had to pay back. And that's exactly what's happened. But it ruined lives. It ruined families. And I'm not saying we don't need the drugs, but I'm saying judicious use of those drugs. And of all of these cases with the opioid crisis, so many of them were peripheral neuropathies that could have been treated in a much more efficient manner if the doctors had known better, if they had been trained better by their continuing education. But the continuing ed is brought on by the big pharma. They're being trained by the big pharma to do more drugs, not how to not do drugs. We want to take a look at some concerning increases, some issues that have been going on. Yeah, thank you, blowing that up. That is going on in America today. Since the 1960s, we see a steady increase in three major diseases that are hitting us. Diabetes being number one. They're looking at diabetes right now being found in children as young as 10 years old, type 2 diabetes. And they're actually creating a new name for that, juvenile diabetes. And type 1 diabetes, you're kind of born with that. But now they have this now juvenile diabetes, and they have another one for as you get older. They're looking at dementia and Alzheimer's is a form of diabetes. And that hasn't even hit this chart that shows over 1,000% increase in diabetes. Heart disease is another one that's on this list that is just skyrocketing. And guess what? Number 3 on the list, neuropathy. It is just out of control. And all we're really doing is masking the symptoms and kicking the can down the road. So we ought to take a look at how much money are we spending in America? How effective are we spending our money on our own health care? What does it cost? Time magazine ran a big issue on this, and it's becoming outrageous of the growth of how fast the cost of medical care is versus the cost of every other commodity in the nation. We won't go into those stats so much today, but the amount of money that's being spent on the healthcare system, $3.2 trillion. And that should kind of scare everybody. That is taking over what our gross national product is going to bankrupt America because we're not getting health care that's effective for us. The United States consumes 75% of all the drugs produced in the world, all of them. 75% of the 75% of what is being produced is being consumed by our population, and we only comprise 5% of the world population. So we might be taking a look at, do we have the best idea of how to get healthy and how to stay healthy with what we need to do? So again, I'm challenging the sacred cows of the American medical model is what we want to take a look at. Now, the American medical model for trauma is incredible. I'm a living example of that. I have a heart transplant. I'm very thankful for that technology. If I didn't have that technology, I'd be dead and couldn't help anybody else. So I'm here to say that we need the healthcare system that we have, but we have trauma care, but we really don't have anybody getting us into health. Like I said, your health is not dependent on a lack of drugs in your system. Every drug has a side effect, at least one. Now, it's interesting that in America, we have the most doctors, we have the most hospitals, they have the most money spent on healthcare. Likewise, if we take a little shift over to the side a little bit and take a look at attorneys and legal actions that are going on, America has more attorneys per capita than any other nation in the world, and we have the highest rate of legal problems in the world. Why? Because if you have everybody that's doing this, they're going to find a way to make some money somehow. Now, I'm not throwing rocks at anybody. I'm just saying we need to. This is the sacred cow that nobody's ever challenged. So the key question is, let's take a look at how do we rank in the world compared to the rest of the world. How healthy are we to the rest of the world? We're not even in the top 10. So anybody care to render a guess on the chat? Give us a guess of where we are. We're not in the top 10. We can't be that bad. Where are we? Anybody? Anybody have an idea? Type that in. No challengers, no takers on the challenge. So where are we? We're not in the middle. We are at number 69. And this isn't my study. This is a worldwide study that does a World Health Index. So guess who is number 70? Mexico. Cuba is before us on this health index. They're like 49. Costa Rica is ahead of us on this health index. They're like number 50 or 52, something like that. So we are way below even, quote, third world countries in our health index of how healthy are we as a rule. Not how long are we living or anything, but how long are they keeping us alive on these artificial approaches. So we got to kind of ask, America's in a crisis, and what's causing this? And I'm touching on those, making you think about these things. Where is this coming from? Well, we're going to step aside just a little bit. That's a challenging thought. Let's give another thought of we have in our home, we have 2 washing machines. One is going to wash your clothes and get them clean. The other one is a social conditioning washing machine that washes your brain. It is the television. And if you think about it, you have programming, television programming. What are they doing? Are they having stuff that's fun for us to watch, or through that television programming, they're actually training us, retraining us to consume, to do what we're doing? America, as a capitalistic country, was really doing okay, but then the big businesses got the idea of, well, let's make a consumerism culture instead of a conservative culture. Let's have everybody be unhappy unless you have the latest, greatest thing. So right now, a new iPhone comes out. Everybody has an iPhone that's a year old. What do? They want the newest one. They got to have the newest one. And they throw away the old one. Consumerism. And that's a brainwashing process that's going on. Well, guess who is the highest advertising on television today? You guessed it, Big Pharma. They're sending $6.8 billion a year conditioning you to take drugs. There is no health index, no health. How do you stop something? It's just how many drugs do you want to take? And as I said earlier, if this drug doesn't work, then we're going to add another drug on top of that, and another drug, until we get it so that you are doped up or don't feel what's going on if it's a pain syndrome. Okay. So we got to take a look at the warning signals on this. Who is the most common culprit on this Big Pharma on the spending? Well, guess who was the biggest spender, the biggest winner in the COVID vaccines? Who made the most money off of that? Well, it was Pfizer. And Pfizer is now reporting that, oh, yeah, by the way, we have these other problems, these side effects that can kill you from taking the vaccine. They're finally coming out with that after the fact, and they're really not being published. Why? Because what television station, news station is going to report that when 80% of their advertising is coming from Big Pharma? Neurontin is one of the biggest advertisers that they're doing in America right now, and it's an anti-seizure medication. Now, you may not know Neurontin by this name, but anybody know Neurontin by the name of gabapentin? Gabapentin is Neurontin, and it is a drug that was developed as an anti-seizure. It slows your brain down so you can't feel what's going on. And unfortunately, Neurontin does not slow the progression of the peripheral neuropathy. The neuropathies persist and continue until you reach the end play on this, and we'll talk about what that is in just a minute. Lyrica is their second biggest seller on this, and Lyrica is also an anti-seizure medication. So if the neurotin's not working, they're going to add Lyrica to this. Or if you have a, oh, I really don't want with that, they give you the Lyrica, which is essentially the same thing with a little different configuration. It likewise slows down your brain so you don't feel your feet. And it likewise does not stop the progression. So we really need to ask ourselves, in this culture of being conditioned to take drugs, are we treating ourselves worse than what we treat our cars? Are we doing better care of our cars than we take care of ourselves? So if you take a look at this, it's kind of silly, but it's really true. This is somebody that has just taped the bumper back onto their car. Are we just taping ourselves together until the bumper finally falls off and we have to do great big work on this? If you have a check engine light come on in your car, what does that tell you? Does it tell you that, oh, this is wrong or that wrong? It only tells you that there is a problem. It doesn't tell you the severity of the problem. It doesn't tell you what is wrong. So when the check engine light comes on, you have to go to a professional that can check out what your check engine light is trying to tell you. So likewise with pain, pain is a check engine light. It says, hey, I got a problem. Doesn't tell you how bad it is. A paper cut feels like it's horrible, but how deadly is that? Versus if you have liver cancer, you don't feel anything until you get terminal. So pain isn't telling you how severe something is. It just tells you something wrong, and it requires a professional to do this. Now, we can take that check engine light and cover it up with a piece of duct tape and ignore it. If anybody y'all watch Big Bang Theory, the gal, Penny, always has something going wrong with her car, and she never gets it fixed. And Sheldon's always worried about that. Well, my son actually did this. He calls me up one day and says, Dad, can you come help me? I said, what's going on? I said, the car won't start. You're stuck? Yes, sir. I said, well, where are you? And I said, what do you think the problem is? He says, well, no, I might need some oil. So I stopped and get 2 quarts of oil. I mean, how far down could it be? And so I come to where he's at and put 2 quarts of oil in. I look at the dipstick, and there is zero. There's nothing on the dipstick. So he has run the oil completely out of his engine, completely. We get, I think, 5 more quarts put in there so we can finally get the engine to start. I said, you drive this home immediately, and you get a hold of your mechanic buddy to come over to your house. Mechanic buddy said you need to get a new engine. So he burned his engine up when all he really had to do is look at the check engine light and do the very basics of maintenance on his vehicle, but he ignored it. And so oftentimes what we do with our healthcare is exactly the same thing. And if we're doing drugs just to cover up the symptoms, we are absolutely covering up that check engine light with a piece of duct tape. When that goes off, you have to go to a professional, and then they come in and they will check you out. As soon as you go in and get checked out, you say, can I drive it? Is it okay? You're like, oh, we got a lot of things to do in here. Their job is to diagnose what you have, and then from that diagnosis, do work on your car. Likewise, you come to a healthcare professional like me, my job is to diagnose what it is. That's coming in, well, doc, I just want to come in and talk to you about this and make me go out and I'm okay. That isn't going to happen. So you're going to have to spend money up front to get a diagnosis. From that diagnosis, a game plan, a treatment plan is created. Likewise, you go in for your car. From their diagnosis, they're going to create a treatment plan. You need to get all these things done, and these things over here should be done. And then you say, how am I going to pay for that? How am I going to get that fixed? Well, we do that because we have to keep using our cars. Well, guess what? You may be taking better care of your car than you are your body. You may be putting more money into your car than you are your body. You may be putting a lot of duct tape on your body, covering it up, taking symptom relievers, but you're not getting at the root cause of what's going on. Really, pain is just an alarm that tells you there's an issue. Just like I said earlier, it tells you there is an issue that you need to get fixed, or you need to get taken care of right now. If you're in a firehouse and you're the guy that's in charge of the alarm that wakes up the firehouse, and you decide you're going to just turn the alarm off, all the people in the firehouse get to keep sleeping. But what happens to the house down the road? It burns up. So let's take a look at what is peripheral neuropathy. Well, it's very simple. It's a damage or a disease that affects your nerves. And what can that be associated with? It can be associated, that nerve can go to your feet, your legs, your arms, your hands, your back. We have a patient that has gone to the chest and the breast. A neuropathy from the mid-back that wraps around and goes into the chest, into the breast, and it's causing pain into the chest. My biggest concern that it was a cancer. We had multiple tests. It's not a cancer. So now we know what it is. And now from getting the testing, then we know how to treat this.
Doctor?
Yes.
I've got a question from Jane. She was asking specifically about her ankles. Does this type of these kind of symptoms go all the way down to the bottom of your feet?
They go all the way from head to toe, but the body will have the biggest issue in the lower extremities, more so than the rest, because the rest of it is closer to the heart, the liver, the lungs, and it's better taken care of. The blood supply, the circulation is easier to work in the upper body. When it gets further away, that's when it starts to get into trouble. And so that swelling is the blood not being able to get back for several reasons, most likely. So yes, this is absolutely, you're right on with that question of this is one of the symptoms that's occurring with this peripheral neuropathy.
Great. Thank you. By the way, feel free to take a drink if you need to. You're doing great. This is some great information. I'm going to bow out. Again, if anyone would like to ask a question, feel free. We've got several people in the chat room asking questions. Be happy to answer anything we can.
So great. So as we saw earlier on the graph, peripheral neuropathy is actually the new kid on the block to the diseases that are increasing by 1,000% plus. Right now, 8% of the U.S. population, 24 million people, are having some form of peripheral neuropathy, and you don't see a blip on the screen. It is not anywhere on the news media. Why? It just doesn't make money. It doesn't make big pharma, big hospitals money. What does do that is to cut body parts off. Peripheral neuropathy is occurring in older age people. Why? Because we're having more difficulties with that. And a full 30% of peripheral neuropathy is from diabetes. So if we start touching on peripheral neuropathy, taking it back to diabetes and having to undo these things, then we're going to step on a lot of toes of people making a lot of money off of drugs. Now, that may be sounding a little cynical, but it's the truth. So again, I'm here challenging some thoughts and some ideas with this. And I don't mind you saying, "Your doctor, you're full of hooey," and we can have a one-on-one conversation and go over these things. I'm not have no difficulties with that, with being challenged on these. So what are peripheral neuropathy? What are the symptoms of that? Some common warning signs is going to be numbness, burning pain, cramping. Now, cramping can be like my mother had. She had restless leg syndrome. And they gave her a drug, I think it was Lyrica, that put her to sleep while she was driving, doped her up so much she ran off the road. We had to have her stop driving because she's taking these drugs. Sharp electrical pains, jamming from one place, going to another, tingling, prickling, loss of balance and falls. Can't sleep at night from foot pain. I want to back up to number 6, loss of balance. So how many of you, or you have a loved one that has a difficulty balancing and it's constantly trying to hang on to somebody or something or a cane for extra stability? This is peripheral neuropathy that leads to falls. Okay. So again, what is a peripheral neuropathy? I really like using analogies, and I like the analogy of the household electrical cord. So everybody's had this old cord, or I go to my grandma and grandpa's house and they didn't ever throw anything out. And those old plastic pieces got brittle and they would break, and you could see the metal wires inside there. You didn't dare touch that thing, but it's laying on the ground. And what's going to happen with that? It could set things on fire. It can do all kinds of different things. But suffice it to say, that electrical current is not going to run through that cord efficiently or effectively. That electrical cord can go to a toaster, and from that toaster, it may not work at all. You can click and dang the thing and it still doesn't work. Or you can click it and it causes the toast to get burned because it gave too much heat or didn't turn off in time. Likewise, Your nerves, having being unsheathed, being unprotected, will cause a short circuiting of your nervous system. And that's what we find going on. And those nerves are much more sensitive, upwards to 1,000% more sensitive to what's going on in your system. So a light touch can feel like a deep burn. You can have a light prick feel like somebody stabbing you simply because the nerve is overexcited. So what are the top causes of the peripheral neuropathy? Diabetes, like I said, 30% of all cases are diabetic neuropathy that's causing this. Poor circulation, and particularly microcirculation. The microcirculation is important because that's what feeds the nerves themselves in the periphery. Toxic exposure, chemotherapy. We just treated a peripheral neuropathy patient with chemotherapy, and fully 30 to even 40 to 50% of chemotherapy patients develop toxic peripheral neuropathy that is never treated. They have lost their ability. We can bring them back and regenerate those nerves if they are just told. Back and neck, herniated disc, spinal stenosis. If you wait too long for spinal stenosis, it's much more difficult. It strangles the spinal cord. We can open those back up, but it takes more effort and more time. So getting these things at the beginning of the symptoms rather than at the end of it is much more effective. Post-surgical surgeries, you can have a slip and a cut, and it causes a nerve. Autoimmune disease, we've heard of these where the body attacks itself and attacks the nervous system. Infections, bacterial and viral. Alcohol abuse, because it lowers the body's ability to have the nutrients for the nerves, and the nerves start to wither and die. Likewise, liver disease, kidney disease, thyroid conditions, all these diseases within the body organ systems wind up poisoning, causing problems with the peripheral nervous system. And we even have medications that cause problems. I will tell them myself. As I said, I was in the hospital. I had a heart transplant from COVID ate my heart, and they had to put me on massive steroids to save my life. And in doing so, they pushed me into diabetes, and then that pushed me into a neuropathy. So I'm getting myself treated still today with this from that neuropathy, and I'm regenerating the nerves from my stay in the hospital. So I'm not just the president of the Peripheral Neuropathy Hair Club. I'm a member. I'm in the trenches with the patients, having to go through this process myself. So let's take a look at a little bit of science on this. So the nerves are made up of a big cell body, but that cell body has to communicate with wherever they go to. They do that by axons. So that's the electrical power cord, and that's covered up with, as you see, this blue right here is covered up with fat cells. In the center of that is a protein that carries the message of the nerve. And because we have this covered this way, it's protected, and we can transfer the signals. And then from this is the large one. This is muscle spindle fibers. It tells us proprioceptors. It tells us where we are in space. Golgi tendon organs goes to your tendons and tells you where you are in space and how much gap and how much energy is being utilized with that. So if we start to mess with these guys, you start losing your ability to balance and control yourself. And so this causes falls. This is where we say, this is the biggest issue. And I have a story I can't tell because I'll start crying of a family member. I'll start crying anyway. That had a fall. She had diabetes. She had difficulty walking. Nobody ever took it seriously. But 1 out of 3 adults over the age of 65 was going to fall. 1 out of 3 is going to fall after 65. Of these falls, 20 to 30% will suffer a moderate to severe injury. 10% are going to die from falling. This person that fell, broke her hip, and died from the blood clot that went to her head and killed her. The leading cause of death from injury over the age of 65 is a fall. And it breaks my heart that I can help people with this and they're not getting the help. This is my passion for folks. So let's go to a little science on the sharp stabbing pains. These smaller axons, these sensory nerves, tell us what we are, how we feel stuff, light touch, temperatures, etc. It tells us to get our hands off of the stove. It's too hot. So that numbness, you can actually burn tissues and cause other tissue damage, causing infections. And then you can't communicate with the rest of the brain and the body what's going to happen, which leads to amputations. In the United States, almost 90,000 people are getting an amputation of diabetic neuropathy. It is the most feared complication of diabetes that there is. The heart, the eyes, yes, the other tissues, but lose a limb. And we have had people that have in the office that we've saved, and we've had people in the office that did not want to get saved, and I'm sure that they've lost limbs. So what I don't want you to feel is that if you've got this condition, that you're hopeless, that there's not a help with this, that you're going to lose mobility, and it's just going to get worse and worse. That being said, I want to show a picture. So on the left side of the screen, if you'll put a little, can you put a marker on that, Chris? On the left side of the screen, you'll see a leg. This was a patient in our office that had sciatic pain, nerve pain in his back, going down to his leg. That is a neuropathy. Dr. John was treating him in the office, and he was about to be released from the pain factor. I came around the corner and saw this foot and this leg. If you take a look at this, it looks like a mummified foot, and it's pretty close to it because it doesn't have circulation and doesn't have nerve flow. Take a look at the color. All of the white flecks that you see on there, that is crust where the skin is weeping, leaking, and crusting up. So with this patient, we did some of our regenerative therapies on him, and to the right, you'll see actually a couple of drops. No more of the crusties on there. You actually see blood vessels starting to pop up into the skin. The skin starts to turn pink. We go to the next level over. This is at 6 weeks, and it looks almost normal. A little blackened around the ankle, a little discoloration in the mid-calf area. Going to the right, one more. We got blood vessels everywhere, pink everywhere, a little bit of dark down around the ankle. So what I want you to see with this is this person did not have to have an amputation because we started doing the regenerative medicine on him. Now let's talk about numbness. How, oh, it's just, I just got a little numbness. Well, your numbness not only affects you, but other people. I want you to take a look at this a little closer. Can we blow this up any, Chris? Okay. So this picture right here is a plate glass window at a restaurant. And I work with a group of doctors. There's 1,200 of us in the United States of like mind trying to help people with this regenerative medicine. And so he was hosting a lunch and learn, just like I was looking at doing the La Hacienda. He was posting a lunch and learn in Florida. And this lady could not feel her feet. And she got confused where the gas pedal was or where the brake was. So while she's trying to park, she hits the gas and her cars go flying into the plate glass window and breaks it. And so this was after it got pulled out. And they went ahead and they had they had the lunch and learn afterwards, but it wasn't in that room. But I just wanted to show you this, is that just having a numbness is not a simple, easy thing to do. What happens if with a numbness, you wake up in the middle of the night and you cut your foot on a piece of glass, but you don't feel it? You go back into the bed, go into bed, and you bleed out. Ridiculous. This stuff happens. You're walking in the middle of the night, you can't see something, you stub your toe, you fracture your toe in your foot, and you never go get it fixed. And because of that, you lost the blood supply, and now you get an amputation. So numbness is not a little thing. God gave us the sensory nerves to tell us where there's danger and how to take care of ourselves. So what choice do you have? Do you have any choice that you can make? As a medical community is saying, just take these drugs and wait till it gets bad enough. So yeah, we've got choices. That's why I'm here. What are your choices? Let's blow this up. Excuse me. Your choices are to do nothing at all. Your choices are you can go to your primary doctor and he's going to give you drugs to mask the symptoms. The choices are you can get your doctor to get a referral to a neurologist. So what's going to happen if you do any of these? Well, if you go to the neurologist, he's going to send you for more nerve tests. You can do more nerve testing. And from that nerve testing, you can say how really bad your nerves are or whether or not so bad. We'll just keep an eye on them. And what is he going to do? he's going to prescribe more medications because he doesn't have any other tools in his toolbox. And how many people have been told this? There's nothing can be done with this. You just have to live with it. Well, to me, that's unacceptable. Just living with it looks like this: a toe that's going to get amputated, an organ or a system or a leg that's going to get surgery, walking with a cane, walking with a walker, getting stuck in a wheelchair. One of our patients that we have, do we have that video clip of the gal walking, Chris? Okay. So this patient right here that I want to talk about, she was stuck in a wheelchair for 2 years, and she wouldn't get out of the wheelchair, couldn't get out of the wheelchair. She finally came to me, and her sister brought her in, and she could not even lift her foot up off the ground. And in 6 weeks' time, we have her walking. She's hanging on to the back of her chair with 2 fingers on each side of the wheelchair, pushing the wheelchair like she would, let's say, a walker. But she's using that because she hasn't walked in 2 years. She's having to learn how to walk all over again. And now she's learning how to walk, and she's going to be doing great. So if you do nothing, if you do the same thing over and over again, Albert Einstein was the guy that came up with this, is the definition of insanity. And why Albert Einstein? Because he was the one that thought outside the box. The science of the day said you can't do what Albert Einstein was wanting to do. And he didn't accept that status quo. The science of today says you just have to wait, take these drugs until it gets bad enough when we cut body parts off, or you fall and die, or you just suffer. That's the science of today. Well, the new science, again, it takes upwards of 23 years to reach mainstream medicine. But because this new science does not include big pharma, it's not going to be promoted. And the continuing education classes aren't going to talk about this. So your doctor's not going to have the information. Okay? But here's the good news. The National Institute of Health said in 2014 that your peripheral nerves have the ability to regenerate as long as the underlying nerve cell, the big brain of it, has not been killed. So long as it's not completely dead, we can grow these back. And that's what we want to take a look at. That's what excites me, to bring people back from the edge and get their lives back where they get to have fun. So when you start having neuropathy, when do you take action on this? Well, at the top screen, let's blow this guy up. Oh, it is blown up. The nerve has blood vessels on it. That's that microcirculation. That microcirculation starts to wane or reduce, and you start losing the covering of the axon. So the plastic covering of the cord starts to come unraveled. The more that it comes unraveled, the harder it is to get you back. So we want to take action as quickly as possible. So there are 5 keys to get this to work. One is we got to rejuvenate the body, the nerves, by increasing the blood flow, and particularly the microcirculation. We have to regenerate the nerve, so actually working in the nerve specifically. We have to activate both of these components, the blood, the microcurrent, and the nerves that's damaged, through therapies that we have available to us today. And we also have to decrease the inflammation that's causing the problem by removing the toxins and feeding the body good, healthy stuff that's going on, that it needs to heal. And the number 5 is what I call the magic sauce, the growth factor. These are the PRP, platelet-rich plasma injections that we can do along the nerve track that accelerates the body's ability to heal. And the research that is out today is using the technology. These technologies that I recommend is what is research that says this is what works. And so that's why we do it. So how do we do that? How do we increase the blood flow? How do we regenerate the nerve? So the therapies we use, cold laser. Cold laser will increase, double and triple the body's ability to do its own naturally occurring items. EPAT is going to be a shockwave therapy. And that's not a shock. It is a pounding component that breaks loose scar tissue. Nerve plate is going to actually stimulate the nerve. I've got a new therapy on here that I've actually vetted finally. And it is red light therapy, but it's very specific red lights. The ones that are out there on the internet that you can buy randomly don't work. You're wasting your money. But the ones that we have an access to now have well-founded research that shows that it works as well as the nerve plate does. Whole body vibration platform is going to stimulate the whole body to get its regenerative forms back together. And then we teach you stretches, exercises, etc., so that you'll be in charge of this long-term benefit. Now you got to ask, does this therapy really work? Well, NASA was looking at the cold laser therapy and found that it absolutely reduces pain and speeds up the healing process in humans. So they did it on animals, and they did it on their own astronauts. It helps to regenerate cells faster. It showed an increase in blood flow directly just from the one therapy, and it promotes blood vessel growth. And it decreased the healing time. It decreases it by half or more. So if it's good enough for NASA and our astronauts, I think it's going to be good enough for us. But why hasn't it hit mainstream healthcare? Because it's not fancy, and it's not exciting, and it's not something that's going to make a lot of money. Now, I want you to remember the household cord. We've got to get this thing plugged up. We've got to get it so that it is sealed up. This is the therapies that we're talking about utilizing. How do you repair that nerve? That nerve plate and the red light therapy that we have available helps to grow the nerve tract, helps to grow the blood vessels on there. The EPAT shock wave knocks off the scar tissue that's strangling the nerve so the nerve can get vitality back to it. The EPAT is also going to get the calcium deposits off of there, and it wakes up your body's own stem cells. Everybody's heard of stem cells, right? Stem cells are in your own body, but they're dormant. This therapy wakes up your stem cells and targets them to the tissue that we're working on. In addition to these direct treatments, we got to get rid of the toxins and the poisons that are in the body, and we have nutraceuticals that will help you do that. Is there research on this? Over 2,000 references. And if you want to get a PubMed, you just type in cold laser, low-level light therapy, shock wave, EPAT, tuned vibration, and you will pull up thousands and thousands of research papers that tells you how this works and how it works with the nervous system. So what I want to bring up is the secret sauce. The research that has the secret sauce, it is PRP, and that is platelet-rich plasma. This is your own white blood cells. We pull blood out of your body, spin it out, take your white blood cells. And if you recall from high school, white blood cells is your immune system. Your immune system heals your body. So you get a cut, a scrape, and your immune system heals that. What we're doing is we're taking your immune system and increasing it at a specific spot so that you can have 1,000% increase in your body's ability to heal and regenerate. Now we can see other advanced ones, stem cells, etc. Not really recommended for working on peripheral neuropathy, but it can be used if we have to go into this. Much more expensive. So why doesn't your doctor know about this? He's not getting any training on it. And he's not looking at any of the research. He's too busy. The doctors have now been pigeonholed into, rather than seeing 15 to 20 people a day, they're seeing 30 and 40 people a day. They don't have time to research all this new information. They have detail people, drug dealers, drug representatives that come in and tell them what the newest, latest drug is and why they need to prescribe it. Again, watch Painkillers, and you'll get a new awakening of the stress, the pressure that the doctors are under, but likewise how they're being conditioned to sell the new drugs. So I want to pause for a second, and I want you to just imagine for just a moment. So just kind of slow down, and I want you to imagine for a moment if you could sleep more peacefully. Get a deeper, easier sleep. I want you to imagine just for a moment, if you would, I want you to imagine being able to walk confidently on a pathway, on gravel, and not having to grab a hold of somebody to steady yourself. I want you to imagine being able to have that ability that you had, say, as little as 10 years ago. I want you to imagine being able to take trips, long trips, without having to stop every 15 minutes to shake your leg out because it's gone dead. Or as my mother, take a long trip with her restless leg syndrome, and she couldn't do it. We had to take her keys away from her because in order for her to get the relief from the restless leg, she had to take the drugs. And the drugs doped her up so she couldn't operate. She couldn't function. And this technology was not available when she was having these difficulties. That was 15 years ago. I didn't know about this. So I want you to imagine being able to do that, having that vitality in that life. I want you to imagine being able to play with your grandchildren. One of my other patients said she couldn't play in the pool with her grandchildren anymore. I want you to imagine being able to have that part of your vitality and life back. I want you to imagine feeling 10 years younger. So imagine that. And I want you to know that there is hope to gain that. We have to follow the rules, but we have hope for that. Why do we want to feel better? Why do we want to do all that stuff? It's for our families. I want to be 80, 90 years old, running down the road with my hair on fire with activity and stop and go, oh, wait a minute, and then fall over dead. I want to live my life to the absolute fullest. I don't want to sit and mold. I don't want to, when I was going to college, I waited on people in the restaurant as a waiter. I hated to see the Sunday old people coming in because they were old and crusty and moldy and grumpy. Well, I'd be grumpy too if I just got out once a week to go to the church and then go to eat, and then I had to go back and sit in my chair at the house. I want to have activities going on. So this is why I do this, to bring hope to people, so that not only do you feel better, but the reason you feel better is to have a more exciting, more full life. So what do you do from here? So I've told you all these things. How do we take care of this? Well, you need to come see me. You got to get evaluated. Just like you check engine light is on, come to somebody who can diagnose what's going wrong with you. Of this, who should come? Well, we had all these 7 symptoms: numbness, burning, pain, cramping, sharp, electrical pains, tingling, can't sleep. You should come. If you've got one of these, and how many have 2 or 3 of these, you got your check engine light coming on again and again and again. That's who should come. So what do we do about that? Well, you got to make an appointment. Simple, easy to do. Reserve a spot. So in the column below, type in, I want help, your name and a telephone number, and we'll get in the best time that you would like to be seen. Okay. We will get in touch with you. If that time and that date is available, we'll give it to you. If it's not, we'll schedule for one that's available. But you got to reserve a spot. My time is used up very, very strongly with the practice. We reserve some spots for you to come in. My doctors have me on a limited work schedule. So I only have so many hours a day, so many days a week that I can work. But we've opened up some spots for you to get in and get taken care of. I've done this, and it's going to be a little bit at my expense. So if when I see you, I'm going like, well, I'm a little draggy right now, it's because I have gone past the recommended what I'm supposed to be doing. But this is my passion, so I make the space. We got to get you in. We got to do an evaluation. From the evaluation, we got to make recommendations of how you do this. Just the same as if you take your car into the shop, we're going to do the same thing with that. We're going to do an evaluation. We're going to do a really good evaluation. Take a look at your nervous system to see if you even qualify for this program. You may not qualify, and that's fine if you don't. But I'm not going to waste your time or my time if you don't qualify. And when you come to this evaluation, this consultation evaluation, I want you to bring somebody that's close to you, a close relative, friend. Why? Because they're going to help you understand what's going on with this. And you'll have somebody to talk with of what did the doctor say and what did this mean over here. You're going to hear a part of that. Now, normal just to get a consultation is going to be $249. So my next slide, it was supposed to be, and I blew it. We're not going to do that. If you want to sign up from doing these things, I'm going to make it even easier and only charge you $89. Now, not only is the $89 going to be for the testing that you get done, that $89 is going to go to if you need x-rays. And I'm going to tell you, 99% of you is going to need some x-rays. So that's going to save you not just the cost of the $249. The x-rays would cost you anywhere from $200 to $400. Now, why do I do this? Why do I give away this much? Because I want you to get well. And I can't help you if I can't diagnose you. And if you're concerned about the money with getting the diagnosis, I can't help you. So I'm taking away that threat of how much does this cost? Oh my gosh, I can't afford it. You can afford the $89 that gets you in and get you checked out with this. Okay. Now, why wouldn't you come? Why shouldn't you come for an evaluation? Who don't I want to see? Who shouldn't I see on this? Well, if you're not really serious about getting better. And I've had patients that were shopping in the past and I didn't screen them out. If you're shopping, don't waste my time. Don't waste your time. So if you're not serious about getting better, let's just be friends. Okay. This was when we did this at the restaurants. But if you just wanted to hear things, but if you're not committed to this, I really don't want you to come in. But before people commit, they have a question. They have two questions. How much does this cost? And how much does my insurance pay? So straight up front, how much will it cost? I don't know until I get under the hood. Just like the mechanic, I can't tell you till I get in there. What kind of averages? $2,000 to $4,000 to $6,000. How much of it is paid by insurance? Some, not a lot. Why? Because it's not big pharma, and we're not cutting off a leg. But I am the Fram oil filter guy. You will see me now, or you will pay for it later. My son did not take care of his check engine light, and he had to get a new engine. Well, there's only so many parts that can be replaced on you. There's only so much time that you have to get it worked on. So while the cost is a concern, I would much rather get a hold of you, see what's going on, and give you an accurate appraisal of what that cost would look like and what is the value of that. And I ought to always take a look at what I'm buying, making a purchase. Is it a value to me? Is it worth what I'm paying? And that's what we'll have to discuss. And again, like I said, if it's not of value to you to get rid of these symptoms and these problems, these things that can end up killing you or losing body parts, then don't spend your money there. Just like the lady that was in a wheelchair, stuck in that, it wasn't of value to her to come see me until she was stuck and her sister who was living and helping her out was no longer going to be able to help her out. She was going to go into a nursing home. And to go into the nursing home, she was going to have to sell her house and she could have no assets so that she could live in a federally funded, I will say retirement, nursing home and wait to die. And again, I want to encourage you with this success story. With as little as in 6 weeks, she's up and walking. We've seen her now for 6, 7, 8, 9, 10 weeks. 10 weeks now. She's walking without a walker. I almost have her dancing. We actually, as part of the exercise in the office, I actually dance with her. Ballroom dancing. And she is getting it down. She is getting her sway down. She's getting her ability to move, to communicate so that she won't slip and fall. She can have a life. Okay? So blow this up for a second, please. I don't want you to wait. Neuropathy is a progressive disease. It does not get better with time. It only gets worse. So rather than getting out of the frying pan and into the fire, this is getting from one fishbowl to another, one bigger problem. So let's take care of it now. We don't want to wait and say, oh, well, let's see what's going to happen with this. So I want to thank you for your time. I wanted to thank you for your interest in this. And I hope that I have challenged you to think, to challenge what you have thought to be true. And I hope that what ultimately I've given you is hope. So with this, I'm going to sign off. Or if you have questions, we'll answer the questions. But please type in below a name, your number, telephone number, date, and time that you would like to be seen so that we can get some help for you. So what kind of questions do we have?
We do. We have a couple of people that have asked some questions. First of all, fantastic presentation, Doctor. I know you've got so much to share. And is this something you're going to want to continue to do, you think, to allow people? We've had several people that want to know if this broadcast is going to be available, if we're recording it anywhere, and we'd want to let them know that we are going to make this available on demand. It's great for you to pass along and share with other people. And so Clyde wanted to know if there's a way that he could get that. You should be getting an email after the event, and maybe tomorrow I'll have to check and see, but we'll make sure we've got a record of you being here, and we'll make sure that you can get a hold of that as well. But do you feel like, Doctor, this is something you'd like to do some more of? You've certainly got more content to cover and some different topics that I know you'd like to share with the folks. Is there anything you might want to tell the folks that might be coming up on the horizon?
So yeah, I'm really just wind me up, turn me on. I've had multiple people down through the years say, "Doctor, you need to write a book. You need to do this." My difficulty is I'm so patient focused, I wouldn't know how to write a book. But if I'm doing these educational things on topics, then I can get these guys out, get the information that I have learned from my school and gleaned from years, 35 plus years in practice. And now getting this new cutting edge technology that I'm getting educated on that I can bring to the rest of the table and help people get rejuvenated, regenerated, such as knee pain. So somebody, instead of getting a knee replacement, which is horrible, and you have 1 in 45 patients with knee replacements throw a blood clot. That's deadly.
So I've got another question from our audience. Chuck wanted to know, is the cold laser good for Achilles tendonitis?
Yeah, it's one of the components with that. It is one piece of that. That shockwave therapy is really, really helpful with that. And we have to take a look at, do you have a sciatic neuropathy that's leading up to that makes it weak? And so the Achilles tendonitis is really a multitude of 2, 3, 4 things at once. And the PRP injection with that, if we take a look at where it is, the PRP can get that thing to grow back, I mean, just incredibly fast. Now, with the Achilles tendonitis, I will tell you this. My older brother we were at a beach vacation. He's walking through the water, and he's only in water about this deep. He's walking through the water, and he yells at me like I threw a rock at him. I'm his little brother. He used to beat me up all the time. So he thought I was getting back at him. And all of a sudden I look at his calf. I says, "Nope, you tore your Achilles tendon." And his Achilles tendon being torn, the muscles bundled up into his calf, and he had a big knot because it wasn't being able to pull that back down towards the tendon. So he waited too long for his Achilles tendonitis. He had drugged it until it got too weak, and then he snapped it and it broke. So yeah, we can help that. It's incredible what we can do with these things. I'll tell you this, the technology we're using today is really the technology that you see in sports today. So you take a look at these professional athletes, these football players, they go out with an injury and they're back in 2 months. And that used to be you're out for a full year. Some of them coming back in 2 to 4 weeks. This is the technology they're using.
Clyde wanted to come back and say that he knows the woman you're speaking of, and he was amazed. So he wanted to say he saw it with his own eyes.
Yeah.
So he wanted to share that. Joy has a question. She wants to know, how do you get these kind of results without drugs? It seems almost too hard to really believe.
Well, the issue is this: your body functions on rules and regulations. Physiology is science. And what medicine has done is they have said, I have a symptom and I want to get rid of the symptom. No reason why to get there. So let's, if we could, and this is ridiculous, let's imagine, just imagine that you have pain in your leg. Your leg hurts. It's hard to walk because it hurts. You're feeling a little lightheaded because, the pain's so bad. And you take a drug and you go, oh, I feel good now. I'm feeling no pain now. But when you investigate the leg, you find a knife sticking in it. The cause of your pain is the knife, not a lack of ibuprofen, Tylenol, tramadol, or any of the drugs. So the drugs don't heal anything. They just cover the symptoms. So if somebody's just interested in covering the symptoms, the drugs is what you want. I don't want to see you because that's not what's going to work. What we're doing is we're putting growth factors, working within the body's ability to heal itself, using the rules of how does it grow itself back. And we were able to accelerate that with this new technology. So it's the technology of turning your physiology on, not turning a symptom off, turning the growth factors on so that they congregate to where they're needed to have you heal. So that's how we do this without the drugs. And in fact, the drugs interfere with the capability to heal. So when we start doing these therapies, you cannot take the NSAIDs, which incidentally, you have 1 in 160,000 people go to the hospital with an NSAID side effect, such as death. People dying from taking these NSAIDs, over-the-counter medications.
Well, that is one of the biggest things that we've seen a lot of people do, and this just be able to wean off of the drugs. To just continue to get one drug on top of the other, not to mention that the symptoms become symptoms of the symptoms. And so I can also testify the treatment that I've been getting, I've been able to easily begin to get off some of these drugs, and I just see a huge difference when that's the
Fantastic.
case. So Elaine just wanted to chime in and say, awesome seminar. Elaine, thanks so much for joining us. It's been a pleasure to do this. We are super excited to do this. And Doctor, do you have any final thoughts? And would you like us to end after you're done? Do you want me to roll that testimony from?
Yeah, we're going to roll a little testimonial for you here. And what I want you to hear is that, yes, I will be doing. We okay?
We're good. We're good. A little AI there. We're good.
So I will be doing more of these because I think that with COVID, people got used to this format of education. And then it's just an easy way to get the information. And then we'll be getting these videos and being able to package them if you want them to send to somebody else, or we'll have a site that they can go look at it and sit on this. We'll have some of these things, they'll be condensed a little bit because maybe get a little wordy. So that'll be a little more palatable. So Chris is my IT guy, on content guy, and being able to make this stuff happen. This is stuff that I've had in my head for probably, 15 years to be able to do. And he's the one that's come along to be able to help me get this so I can help more people.
One more thing I want to clarify, just so that everyone's clear. For being on tonight's webinar, they will get a copy of this. They can look at it, review it, send it on. You've made a special offer. If they want to get started, you want them to call the office, let them know that they were here on the seminar, and you've offered a special package. You want to give that again, the cost to them to come?
So today, I'll extend it to tomorrow, because you may have somebody that you want to sign up. We had from our last one, we had a wife that got her husband signed up. And she's like, he's not here, but I'm going to sign. I said, fine, that's good. My job is to help people. So to do that, rather than the $250 consult fee that you would have, $89 from this. If you say this, it'll cost you $89 to get that done. In addition to the consult, I know I'm going to want x-rays, and I don't want to try to do what you might think is a bait and switch of upcharge you. So I'm just going to say it's going to be the x-rays included. That's going to be anywhere from $100 to $300 to $400. I'll absorb those costs. I'm glad to do that, in the hopes that I can cut out the barrier of money to get your help. So if it's for you, if it's for an immediate relative or loved one, and you want to sign them up for this, call tomorrow and get that time, or get the time that you want. If you happen later in the week, we'd be glad to treat you, to take a look at you, to help you as well. But you're not going to be $89. It's going to be $249 to do the consult. It's going to be $300 for the x-rays.
Great. So, I appreciate you clarifying that. And we're going to end tonight's webinar. Thank you again for your time. We're going to end it with a testimonial from Dorothy Keller. I think you'll really enjoy this. Thanks again for being with us. Good night, Doctor.
Tell me, how were you feeling before we started doing the regenerative medicine on you? What level did you feel like you were able to function and take care of yourself?
Nursing home material. When I started going to the doctors, I wound up in the hospital because I could not literally lift my head up off the pillow. I had to pick it up. I'm there 3 days, and here they send in this surgeon who wants to fuse my neck. And I'm thinking, no, I got things to do, places to go. I've got to be able to move my neck.
Sure.
But one of the things he did tell me is that I should go to a massage therapist. And I have done that religiously once a week. But my massage therapist told me that I needed to come see you. I said, chiropractor? Okay. So I started coming because My knees were giving out. I was having back problems. My neck was just working down the spine, causing all kinds of problems. So when I started coming here, I'm thinking, wow, this is good. I feel better. And it makes sense to fix what's wrong.
Yes.
And I don't do well with medicines.
So did it feel like the lights turned on, like the wattage got brighter?
Yes.
That you weren't as down and compressed. That's one of the common things that lightens us up.
Yes. There is a place to go to get help, because quite frankly, I'm to the point where I don't trust the medical profession, especially after what has happened for the last 3 years and what they did to my knee, knowing only tore my meniscus. I didn't really need a knee replacement. And now the other knee is giving me problems, and I'm not going to go through. That is a brutal surgery.
Difficult surgery.
And this knee pops sometimes, but this one does too, and it's supposedly fixed. So what have I done?
So let's take a step forward. You went forward with some of the regenerative medicine for the spine, the back, and the knee. Tell me how that felt for you.
Oh gosh, when you talked about doing the EPAP, that helped break up scar tissue. And I know I have a lot of scar tissue because the accident that killed my husband 25 years ago is what I'm experiencing with my neck. So I have a lot of scar tissue. The EPAP helped with that. But because of us having such pain in the knees and stopping me being able to keep my house, do the things that I do, because I do live alone, the plasma injection shots, we decided we'd do that. And the first one that I got into my knee was such major, it felt so good. I felt like dancing out of here. The pain was gone.
Amazing.
And then we did plasma injections into my spine to help the trauma I have there. And it's been over 6 months. I don't have pain in the knees, and yet I asked, we do x-rays. Let's see what happened from we started to now. And I don't see a lot of change, but I feel change.
So it's working better, less pain.
Yes.
As we discussed, part of what happens with this, and it takes for ligaments to repair, it can take upwards of 2 years. You have to keep working at it, which is what you're doing. But you start getting the cartilage being replaced as opposed to being decayed. And we're not going to see cartilage on the x-rays. We'll see meniscus in there. We'll see some of the fluid spacing in there, but we're not going to see that cartilage actually replaced. That requires an autopsy, and you're too young for that.
No, I don't want to do that. I'll go to the nursing home first.
So tell me what activities has this approach been able to have you do?
I have a large house. I live alone. I keep my own house. I do all of my own
So
chores.
tell me about keeping the house and the carpets.
Oh, I shampooed the carpets with the machine I bought.
And you moved the furniture first.
Oh, yes.
Gotta move the furniture.
I have Garden of Eden, and it takes work. I mow and edge it, and that's every 5 days because I fertilize it and it
water it,
grows.
yeah.
And I have a third of an acre. So
You're mowing it, edging it, weeding it, keeping it, and
Yeah.
you have one of the pristine yards in your neighborhood.
yeah.
Now, what I could do a Southern boy's not ever supposed to do is to ask a lady what her age might be.
I will be 83 in November. And because my pretty house just sold, I'm going to a ranch house. And so there's going to be a garden, there's going to be chickens, there's cows, and I've got a yard to fix there.
So,
there is no yard.
at almost 83, you got a new adventure.
Yes. Yes.
That's it. Thank you so much for. Now, again, hopefully people will understand this, see this, and take encouragement from your story. If you can get this done, perhaps we can offer this same type of help to them. And I really appreciate you helping other folks.
Yes. like I said, I'm so grateful for Courtney to tell me to come see you.
Courtney's a
And
massage therapist.
I don't go see the surgeon who wanted to fuse my neck anymore because you told me why.
I heard you go. I'm not saying don't go. It's just, what is the purpose in the
And
phone?
when I thought, gosh, what is the purpose and why am I wasting my time?
And your money.
Yes.
It goes there.
Yes.
So we have a limited amount of time and a limited amount of money, and we need to figure out how is best for us to spend those resources.
Yes.
And where do we want to go with that? Does the spending these resources help get to our goal? So when we take a look at the cost of the therapies that go on, one of our gals has just started coming up. Her sister's tried to get her up here for 5 years, and she has declined. And so she finally says, I got to spend my money either with him or going into the nursing home. I'm going to go over here and see if I can get revitalized, as opposed to going down the hill. So she has the resources, just where do you want to spend them?
Yeah.
That becomes a big question.
Yes.